Hi, so time for another one. Now, this story is about my first case that I independently handled. This was with my first job, that was with the Sri Baidyanath Ayurved at Allahabad, and this was a case of a 24-year-old civil engineer from Bhubaneswar. He had fallen down from a construction site about 2 years back and was completely paralyzed on the bed with some bed sores developing. This was a burst fracture of the lumbar spine, and in those days, it was initial years, not much was really in case of online practice, and using available tools of Yahoo Messenger, Windows Messenger, I had kind of come up with this idea of handling patients who were otherwise writing to Baidyanath on their emails, and the emails were not really going out in time. Also, not necessarily that the information would come in. I wanted to reduce the time gap and reach out to people directly. So I would send out messages to all these people, and sometimes they would respond, sometimes they would not. This young man responded, and he sent out his reports from the past. Now, what happened in this case shaped me for future, for a larger sense of time, where I developed a habit of not really investigating too much when things were very clear. It also helped me understand a few other things, which will be something I'll share towards the end. So, when this gentleman came across and he replied, I remember it was an extensive 2 to 3 days of discussion on Messenger. Throughout the day, it would go on. People around me would keep looking at me. There were rumors around me that I was gossiping around. There was a sort of investigation also carried. What was I actually doing? And those saw that I was actually discussing one of the cases that had come across, even to the extent that it was thought that it was my personal practice. So, that besides all the office politics, etc., I was happy that I was getting into patient interactions. When this boy came up with all the details, etc., the next step was to send out a prescription, which we did. And I told him the limited scope that was possible. I told him that with the best that we can do, we would probably be able to achieve around 70% of movements. And I remember after a week, the first message that I got from the gentleman was that he was feeling good, not much beyond that. And I was happy because it was beginning, so I could just feel happy at any good news. Then, around 3 weeks or so, rather a month, when he came back, he said he could finally sit for around 15 minutes or so, and his bed sores were drying. Now, that was the first point where I realized that things were really working. I could see that the young man wanted to walk. I could see the zeal in him to defy the odds. Then, in those days, physiotherapy was not very popular, and he had spent a few lakhs on a spinal surgery way back, which had not helped. So, what I came up with a thought was that along with the treatments that we were doing, he should try to do something because he was suffering from a psychological block. So, I asked him to tie two ropes around him somewhere which he could hold on to. Ropes, because it came to my mind that if I gave him a very solid support, probably he will lean by the support and not try to push his body. And he did, he attempted, and in a week or so, he responded that he was able to walk 5 or 6 steps, but he was happy. And we just went through the revisions of the treatment with his diet, with what to do, with medications, and the treatment continued for around 6 months. And in 6 months, he was good enough to do his personal chores on a daily basis, minimal support required. He could walk short distances from inside of the house to the outside. He could sit for a few uh, hours and work. Life definitely was not coming at the same pace as he had lived, but he was getting into a rehabilitation mode. And that rehabilitation mode, that success that he achieved, was again something that reinstilled something that I said or mentioned in the first story, that it is always the patient's effort that matters. The other thing that I derived from this experience or this patient was the importance of clinical history. The more detailed we have, the more information we have on the patient's history, the way the things have progressed, the events that have transpired, it is easier to understand and chalk out what needs to be done. I clearly remember that I wanted to be a cardiothoracic surgeon at some stage. Having gone into Ayurveda, that didn't seem to become a possibility. But this case really gave me the confidence to indulge into medicine. It became my forte, handling paralytic patients, and I have handled quite a few since then. But the importance of clinical history is something that I still teach or tell my juniors, and this is why, because this problem lies in the story, the solution lies in the story, and unless you know the story properly, much like reading a mathematics question or a physics question, that unless you read the problem properly, you will never be able to find the elements that are already present in the puzzle, and you just need to arrange them properly so that you can solve the puzzle. This man, then I remember, somewhere around a year or so later, came back to inform that he was quite well, quite healthy, and had recovered something like 80-85% of his movements, of his debilities. Definitely, the fracture would not heal as much. Definitely, he had certain problems because of a burst fracture, but life had become easier. He could work again, he could do things again, and that was a lesson again that a patient's tenacity can give him life to succeed. Next, I'll share something else when I talk about my next story. As I said, I'm welcome for your comments, I'm welcome for consultations, I'm always available. Thank you.